Resuming debate, the honourable member for Thornhill.
Madam Chair, today the minister stood and stood by her failed decriminalization project in British Columbia after being forced to walk it back. Last week, she voted against ruling out the expansion of drug decriminalization everywhere else in Canada. Will the minister unequivocally commit today to never expanding her insane decriminalization policy from BC anywhere else?
The honourable minister.
Sadly, Madam Chair, I have to say again, the stigmatized language from the other side of the House is highly disturbing. Decriminalization is one tool of many in addressing the overdose crisis. We see it in jurisdictions around the world, such as Switzerland, Portugal, Spain, because we know it's an important tool that we need to use. I really wish the member would look at the evidence and the facts rather than rhetoric.
The honourable member.
Madam Speaker, the failed experiment in British Columbia was walked back by the minister herself after being forced to do it after a request from BC because of so many deaths. Will she rule it out for her own city in Toronto?
The honourable minister.
As the member well knows, we have said no to the Toronto proposal, but again, Madam Speaker, she seems to ignore this many stakeholders and evidence supporting a full use of tools to address the overdose crisis. People are dying because of street drugs. They're not dying because of decriminalization.
The honourable member for Thornhill.
Will she say no to Toronto forever?
The honourable member for the honourable minister.
Madam Chair, we don't deal with hypotheticals on this side of the House. We deal with facts. I wish the member would actually engage in an evidence-based conversation on what a comprehensive strategy to addressing the overdose crisis looks like.
The honourable member for Thornhill.
Chair, it's not a hypothetical, it's a yes or no question. Will she rule out decriminalization for Toronto going forward?
The honourable minister.
Chair, the member is misleading Canadians. The proposal was already rejected. There is no new application on the books, and we don't deal with what ifs and what abouts. We deal.
Member for Thornhill.
It is a very, very simple question, and I think the people of Toronto who have watched crack being smoked in a hospital, people shooting up in a park next to children, whether she will say no to decriminalization in Toronto going forward. It's a yes or a no.
The honourable minister.
Current proposal was rejected, Madam Chair.
The honourable member.
It's a yes or no question. Yes or no, will the minister rule out decriminalization for Toronto, for Montreal, for Halifax? I'll even expand the question for her.
The honourable minister.
There are currently no proposals put before Health Canada for those jurisdictions.
Honourable member.
Speaker, we're aware that the proposal was rejected from Toronto. Now, if the Liberals win the next election, will she decriminalize? Will she decriminalize? Will she commit to never decriminalizing this in Toronto?
Stop the clock. I just want to remind the other members not to try to participate in this debate unless they have the floor. The honourable minister, and just so the honourable member knows, there's 1 minute and 26 seconds left. So now the honourable minister in 14 seconds, please.
Well, just like the member doesn't have a crystal ball of what will happen in the next election, Madam Chair, we don't have a crystal ball on what jurisdictions will need and ask the federal government to collaborate with them in addressing the overdose crisis.
Honourable member.
The minister is asked yes or no if she will commit to never decriminalizing drugs in Toronto, illegal drugs, her failed, insane drug policy of British Columbia. She's asked if she's not going to bring it forward in Toronto, and she cannot answer the question. I'm going to give her one more opportunity. Will she commit to never decriminalizing drugs going forward in Toronto?
The honourable minister.
I would kindly ask the member to check her language and the stigmatization of those who need our help in addressing substance use and addictions, Madam Chair. We deal with facts, we deal with experts, we deal with evidence, we deal with healthcare systems on this side of the House, and we will continue to work.
The honourable member has 25 seconds if she's sharing her time. Is she sharing her time? The honourable member.
I'm going to ask the minister one last time tonight. One last time. Whether she will decriminalize drugs, illegal drugs, from her insane policy.
Oh, sorry, the mic was shut off. I'll allow the honourable member to re-ask her question.
I will ask one more time. Will the minister commit to not decriminalizing drugs in Toronto going forward? The people of Toronto want to know what she's going to do in her own community because she's already let down BC.
Honourable Minister, there's no more time, but I will allow her to respond.
The City of Toronto knows that it needs healthcare services from the province and to work collaboratively with all levels of government to save lives and address those who use substances. Thank you, Madam Chair.
Resuming debate, I just want to double check. So the time is being split into 3. The honourable member for Fort McMurray Cold Lake.
Is diversion being tracked?
The honourable minister.
According to DASA, it is being tracked, and the RCMP.
Honourable member.
How is diversion being tracked?
The honourable minister.
DASA assists us in tracking diversion.
Honourable member.
BC is looking to add chemical tracers to their safe supply. Will the government make these tracers required in all safe supply across this country?
The honourable minister.
That would have to be in discussion with pharmaceutical companies, but as the member mentioned earlier, counterfeits of drugs are being made in the illegal market to look like real drugs, so it will be challenging.
Honourable member.
The government funds these so-called safe supply programs. They could make it mandatory to put these tracers into the drugs. Will they do it? Yes or no?
The honourable member.
The member fails to recognize that in the illicit toxic drug supply, counterfeits of prescribed drugs and prescribed alternatives are on the illicit market, so it's difficult to.
The honourable member.
The minister is making arguments as to why tracers are absolutely required in these government-funded safe supply. Will she commit to putting tracers in the safe supply that they're funding, yes or no?
The honourable minister.
The member is misleading in her assessment that putting tracers in will mitigate diversion. It's one of many tools, but counterfeit illicit drug supplies will also be an issue, and she hasn't addressed that in terms of enforcement.
Honourable member.
The minister is actively enabling illegal drug trafficking by not employing every tool available to fight drug diversion. Why will the minister not add tracers to their drugs?
The honourable member. Minister.
We haven't currently received such a request, Madam Chair. However, as I mentioned, that would be a collaborative work with pharmaceutical companies and prescribers and provinces, and at this point in time, there's no request before us.
The honourable member.
Will the minister ask her colleagues to increase penalties for diversion?
The honourable minister.
Enforcement is a key part of addressing the illicit toxic drugs.
The honourable member.
Will you ask your colleagues to increase penalties?
Member needs to address all questions and comments through the chair. The honourable member.
Minister, thank you. Will the minister ask her colleagues to increase penalties for diversion, yes or no?
The honourable minister.
They don't listen to chiefs of police from across the country who say that decriminalization is an important tool.
The honourable member.
I'm asking very simply about increased penalties for people caught diverting drugs, illegal drugs. Will the minister commit today to asking her colleagues to look at increasing those penalties, yes or no?
The honourable minister.
Diversion is illegal, Madam Chair. The member well knows it, and law enforcement is doing everything it can and has the tools available to it to address diversion.
The honourable member.
Thank you. We know shipping containers aren't being scanned for cars. Are they being scanned for drugs?
The honourable minister.
That would be a question to the Minister of Public Safety. However, we are in conversation.
The honourable member.
Has the minister advocated for increased drug screening at our ports?
The honourable minister.
We work with all levels of government and law enforcement to address diversion.
The honourable member.
What about at our borders?
Honourable Minister.
All levels of enforcement.
1 minute, the Honourable Member.
Precursor chemicals.
The Honourable Minister.
Precursor chemicals are part of the synthetic components that we see on.
The Honourable Member.
What has been done to actually ban these precursor chemicals?
Working through the trifentanyl group and our other countries, we are addressing it.
This member.
The RCMP clearly asked us at committee and stated that many precursor chemicals were not illegal, despite them asking for it. When will the minister act to ban these precursor chemicals?
The Honourable Member. Minister.
Madam Chair, unfortunately, the member doesn't recognize that many of the pain management medications that are used in hospitals and medical facilities are part of these components, and we have to move carefully to make sure that we are addressing all issues.
The Honourable Member.
People are dying. When will they take action and act to ban these precursor chemicals to prevent drugs from being circulated in our communities?
Last question from the member, the Honourable Minister. We're out of time, but I'll let her respond.
People are dying, Madam Chair, and it is absolutely tragic.
Resuming debate, the Honourable Member for Cumberland Colchester.
Thank you, Madam Speaker. Minister, when did your government fully commit to so-called...
Member to address questions and comments through the chair, not directly to the minister. The Honourable Member for Cumberland Colchester.
Thank you, Chair. Through you, Minister, when did the government fully commit to safe supply?
Again, the Honourable Member is addressing it directly to the minister. He should address it through the chair. I'll have the time restart on this here, and so maybe put the word "the" in front of in front of minister, and that might work. The Honourable Member.
That's great. Thank you very much, Madam Chair, and through you to the minister. When did this NDP Liberal government fully commit to so-called safe supply?
The Honourable Minister.
Madam Chair, we've had a comprehensive program since 2017 looking at all option tools and resources to address the toxic drug supply.
Madam Chair, through you, could the minister tell Canadians since 2020, when they fully committed to safe supply, how many Canadians have died from overdose?
The Honourable Minister.
Sadly, we've lost 42,000 Canadians due to overdose, Madam Chair, but 86% of overdose deaths in the last set of data was from the illicit toxic drug supply, not...
Honourable Member.
Through you, Madam Chair, what was the average street price of dilaudid in Ottawa before so-called safe supply was introduced?
The Honourable Minister.
I don't have that number, but I'm happy to get it for him, but I'm sure he'll tell me.
The Honourable Member.
Well, through you, Chair, I'm quite happy to educate the minister that it was $25 before so-called safe supply was introduced, and perhaps the minister might know what the so-called safe supply has done to reduce the street price of dilaudid. Maybe the minister could tell us what it is now. It was $25. Maybe what is it now?
The Honourable Minister.
I am aware that the street price of diverted hydromorphone has lowered in many jurisdictions across the country, Madam Chair, but we see that the majority of overdose deaths are because of illicit fentanyl and not to the drug that he is referring to.
The Honourable Member.
Through you, Madam Chair, those people who really care about this issue know that the street price for dilaudid has reduced from about $25 to $1 to $2 per tablet, shockingly. Madam Chair, through you, could the minister tell Canadians, has the import and supply of heroin ever been allowed in Canada?
The Honourable Minister has 30 seconds.
Eric? Yes.
The Honourable Member.
And through you, Chair, could the minister tell Canadians, has heroin been legally imported in Canada in the last 5 years?
The Honourable Minister.
As a physician, he should well know that heroin is used in the standard practice of medicine in terms of pain management.
Well, through you, Chair, oddly enough, I did have a pain clinic for 15 years. That's not true. But anyway, that being said, Fair Price Pharma, did they import 15 kilograms of heroin into Canada in November of 2021?
The Honourable Minister.
Just to correct the record, it is true that heroin is used in medical practice, but no, we did not. Health Canada did not import 15 grams of heroin.
The Honourable Member?
Through you, Chair, has any private firm been granted a dealer's license to legally possess, produce, sell, and distribute opium or heroin in Canada?
The Honourable Minister.
There are license holders that can import for research purposes, Madam Chair.
Honourable Member?
Through you, Chair, that's not what I asked. Legally possess, produce, sell, and distribute opium and heroin in Canada. Those were the words. Yes or no?
The Honourable Minister.
As mentioned, they've been licensed for research purposes, so the answer would be no.
The Honourable
Chair,
Member.
Those
1 minute.
Know, pardon me? Canadians should know that Sunshine Lab was granted such a dealer's license in January 2023. Has any private firm been licensed to legally produce, sell, or distribute cocaine in Canada?
The Honourable Minister.
No.
Member.
True, Sunshine Labs was granted a license November 22. How about ecstasy?
The Honourable Minister.
Again, Madam Chair, Health Canada licenses are for research purposes only.
Member.
January 24, allowing them to manufacture up to 20 kilograms of ecstasy. How many applications for dealer's license are currently pending?
The Honourable Minister.
I would be more than happy to get back to the member with an exact answer from officials.
The Honourable Member. 7 seconds.
Would the minister reject further licenses for MDMA or ecstasy, cocaine, and heroin?
A brief answer. The Honourable Minister.
As heroin mentioned before is used for medical purposes, we cannot withhold those licenses. However, we will continue to work to ensure there are strict regulatory mechanisms in place.